Are you a CrossFit athlete or throwing athlete that's been dealing with shoulder pain and you're not sure what it is? You're worried it might be a rotator cuff injury. I'm going to go over today the common signs and symptoms of a rotator cuff injury, what the rotator cuff is, and what treatment might look like for a rotator cuff injury. Hi, my name is Dr. Jeff Lewis. I'm the owner and physical therapist at Lewis Physical Therapy and Sports Rehab, where I have helped countless individuals get out of pain and back to peak performance. So the rotator cuff, I want to start off first and foremost here with what the rotator cuff is. And when we look at the shoulder, we think of that golf ball on a tee. So it's not a symmetrical fit. The shoulder is the most mobile joint in, or one of, depending on the person that we're dealing with, one of, if not the most mobile joint in the entire body. So because of the high level of mobility in the shoulder, we need to make sure that we have a high level of stability to be able to support that joint. The job of that rotator cuff, more than anything, and there's four muscles that make up the rotator cuff: the supraspinatus, teres minor, infraspinatus, and the subscapularis. The subscapularis is the only rotator cuff muscle that is on the front of the shoulder. It sits right on the front of the shoulder blade. All the other three originate on the back of the shoulder, and they all attach towards the front of the shoulder here. So again, the job of the rotator cuff is whenever your shoulder is moving overhead or anywhere in space, the job of that rotator cuff is to keep the golf ball centered in the tee the entire time. When we have some type of rotator cuff injury, what happens is that golf ball doesn't stay centered in the tee, and it can either move too much forward, it can either move too much up. So that's why with people that have a rotator cuff injury, a common sign and symptom that we see is when they go to raise their arm overhead, you start to see this hiking of the shoulder. And that, at that point, is a compensation from the upper trapezius and the deltoid as well. When that rotator cuff doesn't have the ability to keep that compression of that golf ball on the tee, the deltoid, which is the big muscle that's on the front of the shoulder here, is going to win that battle every time, and it's going to take over and cause this superior elevation of the entire arm. So when we go into signs and symptoms, that shrug sign is the biggest one that I've seen, and it's not always, you don't always see the shrug sign in the same plane of each person. I've seen people that they raise overhead, they're in a pretty good spot there, but when they go out to the side like that, they start to get this shrug here, or it might be the opposite, where they might be good in a lot of other motions, but when they go overhead, they start to really get this here. And really a sign of a more significant cuff tear is when someone can't even get to 90 without, like a forward flexion 90, without doing this with their shoulder here. For a lot of these people, reaching with their hand behind their back is going to be bothersome on the front of that shoulder, on that rotator cuff. When we look at pain, it's not uncommon for some people to get pain at night that radiates down the side of their arm. Because again, what's happening, or during the day, what's happening is when that rotator cuff is unable to do its job, gravity is literally pulling that shoulder down out of the socket. So again, the job normally of the rotator cuff is to keep that shoulder, that golf ball, centered in that tee. Now, I've seen sometimes where people have rotator cuff symptoms and they do have some symptoms like a dull aching sensation that goes down past their elbow, maybe even into certain parts of their hand, just based on what is innervating parts of that rotator cuff muscle. So when we have these types of symptoms, it's really important that we look at the cervical spine, the neck as well, to make sure that it is a true rotator cuff injury and not some type of nerve root involvement from the neck. Now, treatment. First and foremost, we want to make sure that we get range of motion back, especially if it's someone that does not have the range of motion of lifting overhead or anything like that. We want to make sure that we get the range of motion back first. In these higher grade or higher injury rotator cuff tears that have much more significant range of motion deficits, we really want to be cautious of how aggressive we are being with strengthening. So we're going to probably start with some type of low-level isometric, pushing into not necessarily external rotation right away, but in a couple other different directions that are not going to directly stress that rotator cuff. There's certain exercises or certain areas of the body that when they're injured, a little bit of some pain or discomfort, I'm okay working with, but with rotator cuffs, I generally am not. It's just something I've just kind of found from experience. I really want to keep the exercise difficult but comfortable for the patient, so not really necessarily being very painful or provocative. So in these lower type rotator cuff injuries, there's going to be a lot of scapular work more than anything. So again, there's some root causes for a lot of these rotator cuff injuries is that if they don't have the strength in their shoulder blade, their scapular region, well, it's going to put a lot of extra stress on the shoulder that could potentially be leading to this injury over a period of time. So there's a lot of scapular strength and stability. And specifically for the serratus, anterior, lower trapezius, rhomboid, middle trap areas more than anything, just trying to get them away from using that neck and levator scap as much as possible. The next thing that we're going to go on to is we're eventually going to start trying to work on challenging those shoulder blade and scapular muscles in some different positioning. Now, I have worked with some people with some lower grade or less significant rotator cuff injuries where we might still want to be mindful of directly doing like direct external rotation, but we're maybe able to start some more global exercises like some rows or pulling variations or some landmine pressing that allows that shoulder blade to contribute to the movement. But we do know that we are going to get some type of rotator cuff involvement with that. So that's why I generally will try to start getting some like landmine presses are a good one. The like a banded pull down or some type of banded row. And I'm not just talking about the 3x10. We might start like a 3x15 or 3x12 to build more capacity. But I eventually want to get to the point where we're doing a little bit more higher load and a little bit less volume to get a little more stress on that shoulder. Another thing that I like to really work on where we're maybe being a little bit mindful of directly isolating and strengthening that rotator cuff is some type of closed chain work. And closed chain exercises are where you're essentially your hands are fixed on the ground. So a perfect example might be you're just in a plank or a push-up position. Not doing a push-up, but you're in a push-up position. Now from this position, we can do weight shifts, we can do shoulder taps, we can do leg lifts with both hands on the ground. We can also then progress to bear crawls. The reason I like doing exercise in these positions is because it is going to allow for some type of co-contraction of that rotator cuff musculature and the scapular muscle as well. So it's going to have some, you're going to have some contribution from some non-rotator cuff muscles if it's that kind of more posterior cuff that is bothered. So again, if you're dealing with some shoulder pain, you're not really sure if it's a rotator cuff issue or if it's another type of shoulder issue, go ahead and leave a comment below with any questions you have, or if you want to get a little bit more direct, individualized help through our approach, go ahead and text the number below and we'll get back to you.